So again, good evening everyone. And this is our second session for Nursing Informatics. So this is week number 2, and we will be talking about definitions and electronic health records. I'm going to introduce to you what an electronic health record is. Okay, so a lot of you, some of you might be surprised because I designated them as co-hosts. Okay, so may I know who are my co-hosts for this session? Okay, who are my co-hosts? So I
People,
think,
sir.
okay, yes. So we have Shane, Shaira, okay, Jazen, and Carlo Lim. Okay, so what you're going to do is you need to admit your classmates who are late. Okay, you need to admit your classmates who are late. And for some of you who are recording the session, okay, you actually you can do that, but I would like to, of course, discourage that because I'm going to upload this on our channel. Okay, so I'm going to upload this on our channel so that you have a reference after this. Okay, so hope you're doing great. And just to give you an overview, okay, for this week. So these are your 5 tasks to accomplish for week number 2. And I have seen that a lot of you already accomplished the task number 2, and that is equivalent to 100 points. So once you upload that screenshot, that is already equivalent to 100 points. So I already checked the outputs of your classmates for course task number 1, and I'm still waiting for others. Okay, so good job, especially for those who submitted earlier. Okay, so you need to independently study the week number 2 course unit at Canvas. So that is about electronic health records from historical perspective. So it discussed about electronic health records and the Davis Awards for Excellence. Davis Awards for Excellence is the most notable award that is being given to institutions as far as their application of the Davis Awards are concerned. And as you can see at the lower portion, right? So at the lower portion, you have your course task. So disregard the course task in your course unit because your legitimate course task are the course tasks that I'm assigning to you as assignment. Okay? So disregard lang yung nahandon sa may course task because we're going to consider the course task that I'm giving you every week as your legitimate course task. So why is that so? Because I want you to focus also on your other subjects. I do consider that you have lots of subjects that you are taking this semester. So I would like to make your work lighter. Okay? So I'm just giving you only one course task. Okay, so you are attending our synchronous sessions now. So that's good for you. You already registered for this because our Zoom sessions are very much important because my Zoom sessions, this is where I'm going to get the questions for the exam. Okay, so for your independent session, you have your course task, and that is very important for your quizzes. You can answer your quizzes, open notes, and for our synchronous sessions, our Zoom sessions, this is where I'm going to get the questions for the prelim examination. So later, I'm going to highlight some of those important concepts, okay? And yon. So you need to remember that because it might appear in your prelim examination. Okay, participate in the discussion boards at Canvas. So I posted there a question, then you need to just reply on the thread. Okay, so it talks about how can we encourage our advanced age nurses to utilize electronic health records because for most of them, they are not that into technology, right? Okay, so answer the multiple choice questions that I'm going to activate after this. So again, your multiple choice questions coverage is are your course task. Okay, your course task and course unit. But for your examinations, our synchronous sessions, just to make it clear. And your course task number 2, which is due on September 5 at 12 noon, is you're going to screenshot, of course, your encoded entry at OpenMRS. And I'm going to give you a step-by-step, of course, a procedure on how you can do that for those of you who haven't yet, of course, submitted. Okay. So, again, you can react You can also send me a quick message here at our chat. So kung may question po kayo, or for example, nawala yung audio ko, o kaya, for example, there's a ghost at my back, so you can just type in that, Doc, you have, of course, you have a ghost at your back. So you need to inform me. Okay. So yun, so for quick messages. And of course, our discussion for today will be opening with, of course, another definition. Okay, so last time we discussed the definition of informatics, and for those of you who already forgot that, so nursing informatics discipline started with health informatics. Before kasi we don't have nursing informatics pa. Meron lang tayong very generic term na tinatawag nating health informatics. And when we say health informatics, this is a combination of computer science or hardware. So you have your information science or the software that we're using. Health science, it talks about the research that supports nursing practice. Cognitive science, that's human intelligence, because machines will not work without human intervention. Right? So for example, your laptops, your smartphones, it will not work by itself. Although we have artificial intelligence right now, so it will not work fully without human intervention. So computers need human. Okay. So also we have wisdom, or this is the ability to tell what is right and what is wrong, right? So it has something to do also with the ethical dilemmas, no? Kung for example, if gagamit pa ako ng computer na to, will that be will I of course disobey the yung principles of respect to my client? So those issues. Again, computer science, hardware, information science, software, health science, research, cognitive science, intelligence from humans, and of course, we have wisdom, or the ability to check whether it is right or wrong. Okay, ethically. Okay, so because of health informatics, so nagkaroon tayo ng another concept which is very much specific to nursing. So we called it the nursing informatics. And according to the American Nurses Association, it is a specialty that integrates nursing science, computer science, and information science to manage and communicate data, information, and knowledge in the nursing practice. Okay, so that is nursing informatics. But of course, me, as an informaticist, I have my own definition of informatics, right? So I'm a doctor of philosophy, a graduate. So therefore, I can devise my own definition. And this definition is being utilized by several colleges of nursing around the Philippines, because I have discussed it to them and they are using my own definition of course, nursing informatics. But before that, let us take a look at it. So ano ba yung computer science? Saan ba namin makikita yan? Information science, health science, cognitive science,